Okay, the medical marijuana is like one of the chinks in their armor. So people say, yeah, it's good medicine. You should let them have it. I wish people would talk more about hemp too, because that's another chink. It's like, it's stupid. Why farmers can't grow this environmentally friendly, profitable, versatile crop.
Just like one of the excuses is that if you have a whole bunch of hemp, you'll be able to hide marijuana in the middle of it, you know, and it's like really hard to differentiate. So
that's what they. Yeah, that's one of their stupid arguments. Well, then you get into this whole argument about crossbreeding, but that's even, you know, that's I don't even want to talk about that because it's just so far-fetched. They don't have any trouble like that in Canada or Europe. They don't have any trouble with, they have a little bit of trouble with kids going and grabbing some buds off the hemp, but obviously, if you're a parent, would you rather have your kids smoke a hemp or pot?
Like people picking apples from orchards.
Yeah, exactly. Nutrition and food science. I mean, hemp is like the superfood, the new superfood. Got hemp ice cream. Got all sorts of different things. You can make brownies. The Dr. Bronner's soap is so good for you.
So pancakes?
Yep, pancake mix, brownie mix, hemp nut, shelled hemp seed is really good. It's tasty. Hemp protein. You go to the Coop, the Harvest Co-op on Mass Ave in Central Square. They have hemp milk, all sorts of hemp nut. So, you know, again, study this. Document all the beneficial aspects of the hemp seed, the essential fatty acids. That's all you hear about on the news. Eat fish oil, you know, it's got omega-3s. Well, guess what? Hemp seed oil has a lot of omega-3s, omega-6s. Got a lot of protein, a lot of fiber. You know, document that. Do a class study. You know, do a taste test. Work with your classmates. Come up with interesting approaches to study this and make school fun.
How long has growing hemp been illegal for? Like, I remember hearing in the past the U.S. government actually encouraged farmers to do it.
Right, that was in World War II, so that was in the 40s, during the Hemp for Victory campaign.
Get on, get on, get on the road to victory. Get off, get off, get off the rusty dusty, and get on, get on, get on the road to victory. Buy another bond today. Get in, get in. Get in your weekly envelope.
As soon as that ended, World War II ended, it was basically illegal.
Was the rationale for making it illegal that maybe someone would try to connect the pot or something?
Yeah, it was basically tied to the marijuana aspect. It's the same plant, the cannabis plant. They didn't want marijuana legal, so they weren't. Hemp is not technically illegal. They just don't issue the permits. And so if they don't issue permits to grow it, you can't grow it. So it's sort of a sad catch-22. Nursing, if you're in nursing or pre-med or any kind of healthcare science, I mean, this is your thesis right here, your term paper, your class study, everything. There's so many different things that cannabis is good for. And I should say, it's not always the marijuana, it's not always the THC. There's 60 or so cannabinoids in cannabis. All of them have different properties, and all of them can help work with different symptoms. So study that, figure out which ones work better. Study the vaporizer. It's a great delivery system. This is Ellie Musica. She's one of the 6 people that gets cigarettes. She gets this from the government every month. 300 of those ditch-free joints that Rick was talking about. She's a great lady, and she's an activist. She's out there on the front lines. She has glaucoma, but she retains her eyesight because she smokes the cannabis. These are a lot of things that you guys probably already know. It's good for nausea, anticonvulsant. It's good for glaucoma. It's even good for asthma, believe it or not. So,
Is that only with a vaporizer that's good for asthma?
No, I don't think so. I think it does something to your blood vessels in your lung.
I have a friend who has asthma, and he smokes, and he tells me it makes it a lot easier for him to breathe like that.
Yeah, my doctor told me.
Does that mean, like, even I don't have asthma when I smoke? I find it's actually sometimes, like, if I'm really, like, congested in my chest, I feel like it's almost, like, easier to breathe, like, the air just comes out easier.
Very cool.
Do you have to smoke marijuana to have it have a positive effect on asthma?
On what? On asthma?
On asthma.
I'm not positive about that. I know you can eat it for any number of other ailments.
I'm just wondering if it has to get in the lungs.
I think it has to get into the lungs.
It sounds like it could. I'm not a doctor. I play one on TV.
Okay, so like just a little bit of background, not to like deter you too much from the general program, but when have they done the research relating to psychological disorders? Because to me, it seems like, you know, like things like anorexia nervosa and things related to appetite and things like that's obvious. But like chemical imbalances within you, like how did they go about like researching that, and what were like the findings? Like what is it about the THC that like balances you out, I guess you would say. Like for somebody with bipolar disorder, you wouldn't think, oh, marijuana is like the treatment, you know, but just, yeah.
I don't know, but see, now that's a good question. Okay, go ahead.
Yeah. Mostly just for people with, say, obsessive compulsive disorder. It'll make them more aware of their actions and be able to slow down their thought process where it's so speedy. Also with bipolar, some ADHD, especially, some cases of schizophrenia where it's not biologically induced, it's just like schizotypal or something.
Yeah.
Just it makes them more aware of themselves.
I think it's almost the psychedelic aspect of like the effects of THC, where you can view yourself from an outside perspective almost.
Well, and also like your brain naturally has cannabinoid receptors, and your brain produces chemicals that fit those receptors. So if you don't have enough of those chemicals in your smoke, that makes up for it in some cases.
And when you do have questions, I just want to say, when you have questions like that, that sounds like a good class project or a paper to try to do some research into it and answer that and add it to the body of knowledge.
I've been diagnosed bipolar, and I can definitely say that it's things into a more reasonable perspective.
Yeah, it's important to note though that, as you say, there are many people self-medicate, but that isn't always a good thing because it can have very different effects for different people, and there are a certain subset of people that can make their conditions much worse actually.
Absolutely. You're right, it's not for everybody, but there are a lot of people that self-medicate and may not even realize it.
Yeah, I wasn't questioning the validity, I just didn't really understand how it worked and what the research was that had been done behind it.
Well, there's
the psychology.
There needs to be a lot more research in all of these areas. Yeah, we have any poli-sci majors in here, you know, analyze Canada's nice policies, they have some good policies. I'm going to go to Vancouver soon.
Come to our conference.
Oh, really?
Yeah, it's in November.
Nice. Do not tolerate intolerance. Absolutely. You know, look, you've got some places like Iran and China where they hang drug dealers. It's really crazy. So, you know,
because they have to do it every year, so clearly not working so well.
So it's, you know, study the different political aspects of prohibition. Yes.
You mentioned Canada. I think one of the big things about Canada and Canadian, a lot of what is in law is really not all that different from what is the law here. The big difference is that nowhere in Canada are you going to find armed SWAT teams going into a cancer patient's home, or even a drug dealer's home. We're going to send a cop to knock on the door, and that is.
Yeah, that's a good point.
That is one of the big things that should have mentioned because people don't pay attention to. It is the way the laws are enforced and police brutality and all the no-knock raids that go on against even alleged cannabis dealers with no evidence. That is a big difference from Canada and the U.S. It's not the law per se, but the enforcement of the law.
This is my puzzle, the cannabis conundrum. And we sort of touched on it, but there's a lot of different factors, in my opinion, why prohibition exists. And you have activists, sort of people in the middle that are out there yelling, screaming, want to get things done. You have patients, medical patients, You have hemp farmers. Hemp farmers don't want to have anything to do with activists or, in general, patients. You know, everybody's sympathetic, but it's like they want to grow their hemp. Patients want their medicine. Activists want everything. Then, of course, you got dealers and growers who they want prohibition because they make money that way. Then you have the hypocritical parents. And you have the people they can't come out because they're teachers and they get drug tested or whatever. So they're closeted by society. But somehow we have to, figure out how to get mainly these three groups together. Because I've been involved with all three groups for 20 years or so. There's just a lot of this, we're not playing well together. And I think the public's coming together or coming around on this issue.
Oh, do you mind if I ask, do you have children?
No.
Okay.
Not that I know of.